Chronicle study is a real-world observational study in which patients considered to have severe asthma, defined by either chronic use of maintenance oral corticosteroid therapy or use of a biologic medication for their asthma, were followed over a prolonged period of time. In all, there were 89 centers that enrolled 796 patients, and 93 of these patients had hospitalizations during the one-year period in which they were observed. The purpose of the abstract was to determine which of the patient characteristics was most important in leading ultimately to a hospitalization for an asthma exacerbation. Of these characteristics, some that were found to be important in increasing the risk of a possible hospitalization included non-Hispanic Black ethnicity, living less than 150 meters from a major road, perhaps due to the effects of air pollution, physically disabled status, along with obstructive sleep apnea, chronic anxiety, and insomnia. Interestingly, allergic status conferred a reduced risk of having a hospitalization upon a patient. One last risk factor that conferred a massively increased risk for having possible hospitalization was the use of oral corticosteroids on a chronic basis. In fact, there was a five-fold increased risk that a patient would require a hospital stay if they were taking prednisone or some other oral corticosteroid on a daily basis. These data from the Chronicle study, I think, help all clinicians focus on those who are perhaps at greatest risk, with the possibility of trying to modify some of these, if at all possible.